Go.
My name is Alvin.
Brianna.
Joshua.
Shannon.
Our topic is coronavirus disease, worldwide pandemic.
For our topic, our group decided to tackle the worldwide pandemic of COVID 19. We researched and discussed the current problems and obstacles having to overcome. In our presentation, we will go over what is COVID 19, what are we looking for in the research, what steps we will take in order to get substantial information, what information did we find in our research, what did our data and research tell us, and did we find a substantial solution or recommendation. What is COVID 19? Coronavirus, also known as COVID 19, is a worldwide ongoing pandemic for over a year now. Scientists, medical professionals, government officials, and analysts are unknown of all the aspects of this fast spreading disease. However, they do know that the disease is easily spread through person to person and symptoms can range from no symptoms to mild or to severe. It is primarily spread through saliva or sickness, such as sneezing or coughing.
Yellow.
13 cases of COVID-19 virus. The problem that COVID-19 has faced since its emergence. What cities and countries have done to the combat of virus, prevent the virus from spreading, resources that are available to the public, looking at guarding races that are being affected more. What step we will take in order to get substantial information? We analyze the sources that are tracking the new COVID-19 cases throughout the world, like Johns Hopkins University, who have a section dedicated to it. We wanted to find on how to help prevent the spread of COVID-19 virus, so that we researched what the Center of Disease Control Prevention, CDC, the World Health Organization, WHO, and United States Environment Protection Agency, EPA, have said because of their specialty in the matter and additional information that could help people with keeping themselves and others safe.
What information did we find in our research? We looked into articles like Weber R, COVID-19 and Race, Protecting Data, or Saving Lives. The acceptance of COVID-19 tracking technologies, the role of perceived threat, lack of control, and ideological beliefs. Fast tracking World Health Organization's COVID-19 technical guidance to training for the front line, and many more. With limited conversation about this topic, race and limited health resources have also played a factor in tracking total fatalities and case numbers related to COVID-19. In the article by Weber R, we found out that Nigerians are more likely to be working in healthcare homes, and Tamils are found to be working in supermarkets. This should be brought to our attention more due to the fact that these places are high risk for COVID cases. With more research from this article, we found out that ethnic groups are 10 times more likely to die from COVID-19 compared to white patrons. In an article by C. Jason Wang, Chunhua, and Robert H. Brock, they explained how Taiwan had developed and applied new technology that was similarly like Corona Alert and COVID Alert NYC. However, the difference is that they implemented QR code scanning and online reporting of travel history and health symptoms to clarify travelers' infectious risk based on flight origins and travel history in the past 14 days. People at low risk, no travel to level 3 alert areas were sent a health declaration boiler pass via SMS, which is short message service, messaging to their phones for faster immigration clearance. Those were higher risk recent travel to level 3 alert areas were quarantined at home and and track through their mobile phone to ensure that they remained at home during incubation period.
What did our research tell us? According to USA Today, the EPA had approved a list of cleaners and disinfectants such as Clorox, Losol, Puro, and other cleaners back in March that can kill the coronavirus. According to the EPA, products on the list have qualified for use against COVID-19 through the agency emerging viral program program, where manufacturers provide the EPA with data that shows their products are effective against harder to kill viruses. What did our research tell us? With the COVID-19 case tracking map, we could avoid the places that have a high increase rate, and we don't need to worry for self-quarantine when we return from high-risk places. Apps like Corona Alert and COVID-19 Alert NYC were created to help people be more aware of when they have come in contact with someone who has the virus, with the use of SMS, text, and alerts.
Do we find a substantial solution or recommendation? Even though that there is no definite solution for COVID-19 as of now, there are many recommended steps we can take to lower cases and allow scientists and medical officials to keep track of incoming cases and seek a definite solution. For starters, listen to your government and medical officials when they tell you to take these steps. Keep wearing your mask, stay 6 feet away from others as much as possible, get tested for COVID-19 often, no indoor dining or large gatherings, and download the Corona app and or COVID-19 Alert NYC to help be more aware in case you need to self-quarantine.
Conclusion. Even though the John Hopkins website provides a good breakdown, tracking cases and deaths are still hard. There could be hundreds of thousands, if not millions more deaths that are still not tracked. New York State has 36,052 state deaths out of the recorded 311,010 global deaths in the United States. Based on comparing the above data from John Hopkins University COVID-19 map data on November 24th, before the Thanksgiving, and to December 18, we can conclude that the Thanksgiving holiday did not in fact cause the amount of cases to rise. However, we cannot say for certain that was the case. With Christmas and New Year's right around the corner, we could expect that the amount of cases will increase. But if people understand about the increase of cases before Thanksgiving and after, they may change holiday plans and decide to stay home to do their part in stopping the spread. Even though vaccines have been sent out, only priority to healthcare workers, emergencies use it will only be available in limited quantities for now. This will be very detrimental to the health of many families. In the United States, there are chances for a widely available COVID-19 vaccine by the next year, and everyone around the country and world.
And that
And that's
concludes our presentation.